Let's talk about neurodivergence and safe foods. Now, if you're autistic, you've probably known about safe foods for a long, long time because it's actually part of the criteria that is in the questionnaires for diagnosing autism. And what are safe foods? Safe foods are those foods where when you're experiencing sensory overwhelm, like tactile or sensory or smell or taste, these are the foods that you can usually eat no matter what, even when you're having problems with other foods. However, if you have ADHD, there hasn't been much talk about this. And there has been recent research showing that somewhere about 40% of people with ADHD actually experience sensory issues with taste, smell, and texture of foods. And depending on our levels of anxiety, sensory overwhelm, executive dysfunction, etc., we can experience issues with the difficulty with finding a food that is not only enjoyable, but comfortable to eat, if that makes sense. And of course, the no-brainer thought is, well, I'll just eat just safe foods all the time, except that most of the time safe foods are usually things that are not super high in nutritional value, things like pasta, ramen noodles, cereal, so high starch, low protein, low nutritional value. And this is also where some of the binge eating issues come from with ADHD as well, in that we can't eat or we don't feel hungry, and then suddenly we're starving, but then we're also experiencing sensory overwhelm. So we'll go to like a one food that we can eat, and often that is a salty, crunchy, or like squishy, carby thing, which not good for us, I mean, like carbs some good, carbs lots bad. But in general, carbs are always safe. They're usually the safest foods for us. Mashed potatoes, ramen noodles, mac and cheese, breakfast cereals, cookies, potato chips. Yes, those are all the comfort or safe foods that we experience, but on the same note, it also means that sometimes if that's all we can eat for days on end, it's not an especially healthy thing for us. So I guess, in closing, keep your safe foods handy for those days, because it's better to eat something than nothing at all. But also, make sure that you're doing things to ensure that you can eat more than just your safe foods. Take care. Be well.